What's most exciting is therapies. Through all these years, we've been able to make a diagnosis, but we really haven't been able to give patients tools to manage their symptoms, and that's been a real deficiency in the porphyrias. But more recently, the emergence of these new therapies, which are not only helping to manage symptoms, but are truly disease-modifying therapies, are so very exciting. I think to me, what drives me is the thought of getting patients symptom relief and treatment. It's incredible to be able to help a patient who is in need, and in rare diseases, this is so needed because very few rare diseases have effective therapies. So this emerging landscape of exciting treatments really excites me.
What's exciting to me right now is all of the new therapeutics and how they can improve patients' quality of lives, which again is my area of research. So that is very exciting that there's so many new things, new potential therapies in the works.
Oh, all the new therapies coming out. Just things to help patients, whether it's with acute hepatic porphyrias or whether it's for medications to help come out and help people with the erythropoietic protoporphyria.
I think this has been a very exciting time for treatment and development of new treatments for patients with all different types of porphyrias. We've had a new treatment, effective new preventive treatment for acute hepatic porphyrias. It's really the first new effective treatment since panhematin, which was developed in the 70s. So, we're talking 50 years here. For the cutaneous porphyrias, there's now an approved drug for treatment of or improvement in symptoms for EPP, and there are in development in phase 2 and phase 3 trials several new treatment options for EPP. So that's a very exciting time for that.
Probably the most exciting thing are the new treatments and the increased interest among drug companies in developing possible new treatments for the porphyrias. I think we all know that heme has really stood the test of time and continues to be the treatment of choice for acute porphyric attacks. Givosiran, brand name Givlaari, has been developed and approved recently, and it is proving to be very helpful to prevent recurrent attacks in people that suffer from these frequent acute porphyric attacks. In the area of erythropoietic protoporphyria, probably the most exciting developments have been the approval of afamelanotide, the ongoing testing of another drug that has similar action, but unlike afamelanotide, can be taken orally rather than needing to be implanted subcutaneously. Dersimelagon, that's being worked on by Mitsubishi Tanabe, and then another new one that is just about to begin clinical trials, a drug called bitopertin being developed for erythropoietic protoporphyria by Disc Medicine. So it is an extraordinarily exciting time, actually, after having very little for many, many years, to have, in just the past few years, a number of new and very promising and some already approved new drugs.
Well, we've got a number of new treatments that are being developed by drug companies, and they're being brought to the level of trying to get FDA approval, and that's happened particularly in the last 5 years or so, and that's certainly been very exciting. There's also been a lot of work on molecular aspects of porphyrias, which has increased our understanding a lot.
As neurologists, that we started to be involved in the acute hepatic porphyrias mainly, and it has been brought on our map again as we see those patients in the ER, most of them that we think that they might have Guillain-Barré syndrome or something like a common cause of acute neuropathy, while in fact they turn out to have porphyria. So I am very glad to be a part of the Porphyria Consortium and raise awareness of porphyria as a disease among my fellow neurologists.
Well, this has never been a better time to work on treatments and eventually cures. And so our lab is very interested in understanding what, using animal models to really understand the pathophysiology of an attack, a porphyric attack, to understand the pathophysiology of some of the cutaneous porphyrias, and based on that, to learn how to alter that with various approaches to therapy. We were very involved in the development of Givlaari, which is for the acute intermittent porphyrias. We also were involved in the clinical studies of a couple of the drugs for the cutaneous porphyrias. And now and in the future, I think where things will go is maybe to a cure one day. So we're going to learn how to manipulate the genes so that we can replace them in a very safe way for some of these porphyrias, or to augment genes so that they work better. So I think that's kind of the future of things, but that's looking into the crystal ball. We're a long way from there.